Well, hey, everybody, this is Robert, and welcome back to Outbreak News Interviews. Now, a few weeks ago, the CDC issued a Health Alert Network health advisory. This is to notify healthcare providers, public health authorities, and the public in general about current increases in human parvovirus B19 activity right here in the United States. So, what is parvovirus B19 and why this alert? Well, joining me today to discuss this viral disease is Judy Stone, MD. Judy is an infectious disease specialist and a longtime contributor to Forbes.com. Dr. Stone, welcome back to the show, ma'am.
Thanks for having me again.
You bet. Well, let's go ahead and just start with a summary. Can you give the audience an overview of parvovirus B19?
Sure. So Parvo is mostly a childhood viral infection, usually in kids ages 4 through 10. The thing that it's known for in the appearance is having a slap cheek appearance, but that only occurs after the person has passed through their infectious phase. So it starts with a low-grade fever, headache, flu-like symptoms, and then you get the rash, and that spreads. And once you have the rash, you're not infectious anymore. So transmission of the virus is through droplets and saliva, so sneezes, sharing drinks, touching surfaces that have been contaminated by viruses. And as you saw here, the transmission is more in the winter and early spring, as we had now, prompting that health alert. You can also get it through pregnancy, maternal to fetal transmission, or through transfusions on occasion.
Okay. Now, just to be clear for the audience, this is different from dog parvovirus.
Right. They're completely different. And one of the things that's important to stress that the two kinds of parvovirus can't be transmitted between species. So you're not going to give your dog B19, and they're not going to give you the deadly puppy parvovirus.
Yeah. Now, this is also known, some people may know this, as fifth disease. Dr. Stone, can you talk about how it got this name?
It's really strange, and I couldn't go back to the origins of it. But basically, when they were first describing childhood rashes, they were talking about measles, scarlet fever, rubella, something called Duke's disease, which I guess has now been thought not to be real, and then Parvo, which they called erythema infectiosum, or fifth disease, because it was fifth in the ones that they described. And then the actual virus was just identified in 1979 when they were looking at hepatitis panels, and this particular virus popped up in row B, sample 19, and that's how the name stuck. I thought that was very peculiar.
Yeah, just another curiosity. About a month ago, my youngest grandson, he got sixth disease, which is roseola.
Right.
Yeah. So there's 1 through 6.
To mention that, yes.
Yeah, of these different rash-causing diseases. Dr. Stone, what prompted the CDC to issue a health alert network on this disease at this time?
They suddenly saw a much higher incidence of it. So from 22 to 24, they saw a 15% increase. And then until June of this year, there was suddenly a 40% increase and a striking increase in plasma donors. And they hadn't seen that before, so that's why they alerted people. Also because it's quite highly contagious.
Yeah.
And has some serious consequences.
Yeah, and we're going to get to that in a moment. Now, I found it interesting because in general, it's a very mild disease. Correct me if I'm wrong. And most physicians do not test for this.
Right.
Right. So it was kind of curious to me how they related parvovirus B19 to a massive increase. And I also saw that there's an increase going on in Europe at the same time.
Right.
Yeah.
So I think, well, they don't test for it. The appearance is quite characteristic. So
Right.
if they're suddenly seeing that, as well as the same time sampling blood donors for a variety of viruses, that's what attracted their attention to it.
Yeah. Now you talked about how you can track this virus, this respiratory droplets. Um, how contagious is it? I mean, is it measles contagious, or is it somewhere lower down the ladder?
No, it's lower because measles and COVID are airborne, and and TB, and parvovirus is droplet
Hmm.
respiratory secretion. So it's kind of a second tier
Yeah.
level of threat. And that's why particularly kids are a problem because, they're spitting and snotting all over everything,
Right.
especially, especially the young ones. And so that's why parvo is a problem, particularly with kindergarten and below that, daycare centers, and a risk um, for the staff of those daycare centers. Um, so what usually happens is that the kids will pick up there will be an outbreak in a daycare center, and then the kids will bring it home to their families and infect their parents and older siblings.
Now you mentioned in the introduction about the slap face appearance, which is highly characteristic of fifth disease. Um, what other symptoms may a child or an adult have? And can you delve a little bit into the complications that because it can happen?
Sure. Um, Actually, one of you see uh, common symptoms, fever, runny nose, headache. So it's indistinguishable early on
Right.
from anything else. And unfortunately, that's when the kids are most contagious. One of the things that's atypical is you can often have arthritis of your hands. And in fact, I guess when I was in my mid or late 30s, I developed arthritis, and it started with both wrists. And I asked, because that was such an unusual manifestation, and I didn't like the idea of being told I might have rheumatoid, I asked my doctors to test me for parvo. And the answer was, huh? But they did, and I didn't have parvo. Uh, so that's one of anybody who has that kind of atypical hand arthritis, especially if it's bilateral, should be checked for parvovirus. Um, the greatest risk is to pregnant women, and about half of women of childbearing age don't have immunity yet. Immunity arises as you get older, from
Mhm.
childhood until you're an adult, and by the time you're my age, most adults have evidence of immunity, but only half in childbearing age. So these are the women who have particular risk of developing birth complications, including um, uh, miscarriage or uh, a problem called hydrops, which can lead to the death of the baby. It's an edema that occurs with profound anemia. The other people who get complications are those who have anemia from sickle cell, or from in Africa, I guess, from malaria or hookworm infections. So
Mhm.
if you have an underlying anemia, you can develop a complication called aplastic anemia, which basically your red cells are wiped out and can't make any more red cells, and you could die if that's not treated with transfusions, supportive
Right.
transfusions.
Yeah, some serious stuff there.
Right.
Um, Dr. Stone, is is there any reason for somebody to actually have to see a doctor for this? I mean, other than the complications, but do
No,
you, if you have these symptoms, the milder symptoms, is it necessary to see a doctor?
I wouldn't.
Yeah,
Again, um, if you have a kid who's sick like that, you're going, and you see, especially once you see that rash, you're going to get scared and want to go to
sure.
the doctor. But there's really nothing to do at that point unless there's ongoing symptoms. Very
Mhm.
rarely you'll get an ongoing arthritis or anemia, but routinely there's no treatment. Just treat symptomatically with Tylenol. or non-steroidal. So there's no treatment, there's no vaccination, there's nothing to do about it except tincture of time.
Mm-hmm. And can you talk a little bit about prevention? You said there's no vaccine. What else have you done?
Well, I was good hygiene, so not sharing cups and drinks and food. Um, and even the CDC says you should wear masks for prevention if you're high risk. So if you're pregnant or a childcare worker, you might want to wear a mask if there's infection going around. One of the problems with that is, many communities are starting to have mask bans, and so that's preventing people from protecting themselves. And in fact, Nassau County is now being sued by a disabled community for their recent mask ban that doesn't allow people who are immunocompromised to wear masks.
So what is their justification for a ban?
To reduce protests, anonymous it came out of the Gaza Palestine protests, but there's ample data that masks are not good as preventing surveillance and facial recognition. There are a whole number of studies that just seeing your forehead or your eyebrows is enough for facial recognition.
So this clearly bothers you. You mentioned it in the article. You mentioned it in an email to me. What would you like to see change, and how would you go about it?
Let me count the ways, Robert.
Okay.
So, what's bothering me about the CDC and the whole COVID and masks, the CDC has been living in denial and minimizing COVID. You hear Mandy Cohen saying, we're in a better place. This is at a time when we have 1 million infections a day and 1,000 deaths per week from COVID. You had, I guess, part of it, and from my background, I write and care a lot about vulnerable people and disadvantaged populations. So before we had Dr. Fauci saying, the vulnerable will fall by the wayside. They'll get infected, they'll get hospitalized, and some will die. And then Walensky, who said the overwhelming number of deaths occur in people who were unwell to begin with. So this is really encouraging news. Talk about annoying the millions of people who are disabled. And then, as I say, Mandy Cohen now saying we're in a better place and minimizing it. So I think that's one of my big gripes. Another is that they are ignoring that COVID is airborne, and they are constantly telling and have on their website and all of their PSA announcements on Facebook and Twitter and wherever, wash your hands. They don't say wear a mask, COVID is airborne. They say wash your hands, good hand hygiene. So that's just deceitful. They're not pushing adequate ventilation. They're wanting people to go back to schools and go back to offices to improve the tax base. In Washington, for example, they're wanting to make all the federal employees go back to the office, but they haven't done anything or told the public or told the employees what they're doing about improving the ventilation in those settings. The most recent thing that they did is to say that people can go back to work when they're afebrile for 24 hours. They used to say you needed 2 negative tests 48 hours apart.
Yep.
Well, they're sending people back to school or back to work who are still clearly infectious. Many people shed virus for 10 days. And so to tell them to go back and they don't need to take any precautions or maybe should consider wearing a surgical mask, that's just exposing people unnecessarily to COVID. So, and then they stopped the reporting of hospitalizations and tracking tracking. So the denial is what is infuriating to me.
Mhm.
And they're also stacking their HICPAC advisory committee on infection control in hospitals. It has been stacked with mask deniers rather than ventilation experts and occupational health experts. So I could go on, but that's the overview.
Well, we'll have to put your name in for the next CDC director then.
No, thanks, but I would be happy to be on their HICPAC advisory
Okay.
committee.
All right. All right. Well, let's move on to a little lighter subject, and that is, and I just learned this the other day, that you've been writing for Forbes.com for a decade now. So that's a lot of articles about infectious diseases in 10 years. So, Dr. Stone, I was just going to ask you, do you have a favorite piece that you did? One that got a lot of reaction, or just you just thought it was your personal Mark Twain masterpiece?
I have two favorite pieces.
Mhm.
My all-time favorite will may or may not surprise you, since you know me fairly well. It was on called The Political Battlefield of Infections in Migrant Children's Bodies. So it was a story from 2019, actually, based on a journal article by Dr. Mark Travasas on the deaths of migrant children in detention. And that before 2018, no child had died in Border Patrol custody. And then in the 10 months prior to that article, they had 7 children die. And because, as you know, I'm the daughter of Holocaust survivors, this really hit me personally, seeing the kids in the cages, and then dying because of neglect by the Border Patrol. So, because one child, for example, died, did not get was diagnosed before he died with having an influenza infection, but didn't get any antivirals. He was given a worthless antibiotic and then died.
Hmm.
Others died of sepsis. So, as I say, that, I think that one of the things that, and no, I don't have the answer for this, but one of the things that most people here don't know is that seeking asylum is legal and has been for decades. And this came out of 1938 conference, where the Evian conference, where European countries got together to address the Jewish problem. And people, European countries and US and Canada not accepting Jewish refugees, and they didn't change anything. So I see the same sort of parallels. So that's why that's my favorite article, linking the past to the present and what's going on. The second favorite article is my recent story about Boston, in particular Boston hospitals, Mass General, as well as UCSF, telling their staff, medical staff, that they could refuse to wear masks even if an immunocompromised patient asks them to. And I've interviewed a number of people. I mean, I think that's unethical, outrageous, just anti everything we've been taught in medical school. So I've spoken with a number of patients who have said they no longer are comfortable seeking medical care because the staff refuses to take care of them in a safe manner. And again, they don't know about ventilation, but they refuse to wear masks. And this is increasing. This is happening increasingly frequently. So that's why that's my second favorite, and drew quite a bit of interest.
Good, good. I have to say that I did not see either of those, so I'll have to delve back into the archives and take a look at these.
I will send you the links.
That's how much I like them. But
I
anyway,
wouldn't want you to miss them.
Of course not. And I want to encourage listeners to go to Forbes.com and check out Dr. Stone's body of work. And I will link to the Forbes article. And let me bring it up here real quick. It's called CDC Issues an Alert About Parvovirus. Here's what you need to know by Dr. Judy Stone. And I'll put that in the show notes for everybody to see. And I want to thank you, Dr. Judy Stone, for your time and your expertise and joining me again on the podcast. I appreciate it, ma'am.
Thank you again. It's always a pleasure, Robert. Thank you.